had surgery, elective surgery for an aneurysm because he had terrible headaches and the doctors felt there was something going on. The surgery went very well, but immediately afterwards he had seizures and numerous strokes. As a result of that, he was in ICU at Evanston Hospital for 3 weeks, and then he went on to Holy Family Hospital for another 5 weeks, and then he went to Maryhaven Nursing Home for 3 months. After his stay at Evanston Hospital, there was a lot of pessimism on the part of certain doctors that Bill's recovery did not look particularly positive. So it was a very difficult time because we didn't know if Bill would remain in a nursing home for the rest of his life, or whether he would recover to some extent and be able to be somewhat self-sufficient. During his stay at Maryhaven, Bill worked very, very hard, as did everybody around there, including especially the people in rehab, Abel and Nina and all the others in the facility, to help Bill reach his potential. And by the time he left Maryhaven, he was able to walk with a walker, and when he came home, we had some help for a few weeks. I think it was maybe 3 weeks, and then after that Bill was able to take care of himself fairly well. And as you can see now, he's very self-sufficient and is doing extremely well. He has a few little issues still that he needs to be working on, and he is going to rehab. But all in all, I think everyone has described it as a miracle, and I guess it really is a miracle.
Well, as you can see, I've recovered fairly well from my stroke last fall, and I have a lot of people at Maryhaven to thank for that, including Abel, Ina, Arnell, and others who worked so hard to help me get better. And as you can see, it's been effective. I'm getting along very well now. There's a few small things that have to be corrected yet, and they're coming along.
We're very grateful to the staff at Maryhaven, to all the folks in the rehab department, to all the nurses and the aides, for everything that they did for Bill.